Okay, so chapter 7 is on advocacy for dental care. This starts on page 92 in your book. The learning objectives will be to identify 4 roles that the dental hygienist can assume as an agent of change, describe the various levels of change agent performance, utilize tools and resource models to implement change, identify the role of the change agent in policymaking, promote partnership and coalition development, describe inter and intra-professional collaborations, and identify components of grant writing. So after reading this chapter, you should be able to promote the profession through service activities and affiliations with professional organizations, promote the values of oral and general health and wellness to the public and organizations within and outside of the profession, assess the oral health needs of the community and quality and availability of resources and services. Facilitate client access to oral health services in a variety of settings, advocate for effective oral health care for underserved populations, and access professional and social networks to pursue professional goals. So, advocacy, social advocates implement change in regard to how dental care is delivered, who is able to receive it, and how to ensure sustainability of a program. That's also really important. While you could run a wonderful pilot study where dental hygienists have a crazy expanded scope of practice, if if it doesn't have sustainability, if you can't keep it going, then it's not going to help the overall community. You need to do small things. It might take you very small successes in order to have that long-term prognosis and have that long-term sustainable change versus, having very successful short-term sort of things. Primarily for dental hygienists, our advocacy really needs to be in public health. And I mean, the book is about public health, so obviously it feels public health is a good thing. But I mean, as hygienists, getting an expanded scope of practice isn't necessarily going to make us a ton of money. If any of you guys talk to Miss Vaughn, she's very clear with how much it costs because her significant other is a dentist and he has practice here in San Antonio, and it's expensive to run a practice. And so while the we might be advocating for expanded scope of practices and for autonomy and regulation of ourselves, we might be advocating for that, but we're not necessarily advocating for that for more money, right? That's not what it's about. And so if your drive is I want to make lots of money, advocating for an expanded scope of practice is probably not going to be very fruitful for you. But if your goal is to help the public, then you're probably going to see the most success in public health because that's really where the need is. Okay, so a change agent is an advocate of some kind, and they according to your book, it's typically with social advocacy, so it's a social advocate, and they're referred to as a change agent or an individual who intentionally or unintentionally causes social, cultural, or behavioral change. A change agent proactively bases action not only on a vision, but also on well defined goals and measurable outcomes. This is important. This is the difference between someone who is advocating effectively and someone who isn't. Are those goals, well defined goals and measurable outcomes? So rarely is a sole person entirely responsible for a total evolution, and rarely does a true change agent take credit as a sole individual responsible for change. It's almost always a team. And we're going to talk about individual roles that change agents have and how important each of them are. But being able to collaborate and work with others is a very essential part of being a good change agent. And so when you're working with others, in order to get them on your side, you're going to have to empower them. You have to talk to them about all the things that they can go forth and do. And you have to really encourage others to take up this cause with you because it's important. Obviously, if you're putting everything you are into a cause, then you want other people to work with you and they need to catch the passion that you have for your cause. And so a good change agent is going to know what resources there are available, and they're also going to be aware of the position of those who oppose change. I know, some of you guys maybe were in debate, and that's how a debate works. First, you have your points of why, you're right, and then you have to bring up the other people's points too, and then say why those aren't good points, right? So, in order to be a good change agent, you need to understand why this change is important, but you also need to understand and hear the reasons why other people might be against this change. Okay, so understanding change. Change is an evolution from one state to another state. I know you guys all know this. Change is incredibly difficult for a lot of people. It can be abrupt or it can occur slowly. Things are always changing. You're never exactly the same. So while you might find comfort in the current, spectrum of where you are, that spectrum is always evolving. And so you're never going to be nothing's ever going to be exactly the same. And so change has to occur in order for things to grow. There is a need to create change in individuals that govern policy because policy needs to evolve in order to, help with the increased demand or the evolution of technology, things like that. We need to change policy. It has to happen. Success depends on one's ability to understand others and resolve to work with them regardless of goals or interests. This can be incredibly difficult. Your book goes into how sometimes history plays a role in your ability to work with others because you might have been offended at some point by something that they did or said or whatever it is, but that doesn't necessarily mean that that they're no longer able for you to work with them. You should still reach out and try to get as many people on board and on your side as you possibly can because that is how change happens. um, and so if it were not for individuals empowering others to change, then things don't change. Um, and you have to advocate for patients' health by affecting changes in their behavior, right? So while when we talk about advocacy and legal things and growing our scope of practice, that's wonderful. But dental hygienists are already behavioral change specialists, and so we already understand what it takes to talk to our patients about, hey, here's a problem, let's move towards a solution. We're already there. And so we are really well equipped in the concept of understanding others' motivations and drives and inspirations for change. We already have that innate concept. It's already embedded in our practice. And so when we talk about policy change, it's almost essentially the same sort of goal. We have to motivate others. We have to get people on board. We have to, if you have a kiddo, you got to incorporate their mom or their dad or their sister or whoever it is. And so we're already there in this agents of change behavioral wise for our patients, but we need to use it also in our legislature and regulatory systems. Okay, so roles and responsibilities. This is on page 94 in your book. Um, Hygienists are advocates for patients' health by affecting change in their behavior, change in dental office protocols, change in products used, right? We talk about how it's important to evaluate our products, and change in the dental practice of dental hygiene through legislative and regulatory systems. That one's obviously a much more involved process. But every day we make decisions on, does this patient need a certain type of toothpaste? Or, is that toothpaste good? Or I read a study about this, new practice, or, maybe I'll change up my routine or something like that. Every single day we're incorporating things to change. We're always getting new stuff. And so it's important to understand how much of an advocate we are for our patients' health, and our community overall public health as well. Okay, so the roles of the dental hygiene change agent, there's four of them. The first one is a catalyst, and it's defined as an agent that provokes or speeds significant change or action. In order to be one, you have to understand what needs to change, and you need to motivate others to transform their opinions and actions. In order to do this, positive dental hygienists motivate patients to invest in themselves as a priority. This is someone who is out there speaking passionately, motivational speaker, who is getting others on board. Then we have a solution giver who is a problem solver and is vital to establishing or maintaining rapport among a group of individuals, such as a dental office. The solution giver is the person who thinks outside the box, and they offer those creative problem solving skills in order to break the problem down into different components. They can then examine each one. The solution giver is kind of that logical thinker, that person who's like, okay, here's our goal, but what are our objectives in order to meet our goal? That's that person. The resource linker is or sometimes called a facilitator, and it's someone who brings together individuals who share interests, abilities, monetary support, or common goals. This is someone who's kind of been around the block and they know people, and so a resource linker is someone who knows someone who knows someone who gets you the job kind of thing. They're someone who, oh, I know someone who works in that company, and so I'll talk to them, they'll talk to their boss, and then their boss will be on board with our change. And so it doesn't seem like they're probably one of the most important people, but they are the people who get that motivational speaker in the door. That person would never be heard without the resource linker or the facilitator. And then a process helper is someone who understands all of the aspects. They're the ones who see things from that higher perspective, and they say, okay, well, this person knows someone, and I think that they should link up this person in order to go and talk to them. They're the ones who kind of manage behind the scenes. They see where things are needed, and they might redirect some of the things where, they see a stall happening, and so they'll redirect focus on a different aspect. There's the someone who has kind of their hand in all the different cookie jars, and they know what's going on with each individual group, and they're the people who are kind of putting things all together. Um, so your book talks about actions, and how there's the change. The word change is a verb, and verb is an action word, right? That implies action. And so change is that process of going from one state to another state, right? So it thinks it's important. These three specific verbs are very important in what change really means. So first is modifying, and to modify something means to make a basic or fundamental change without losing essential components. So, we just redirect a little bit for modifying. Altering is when we deviate from what is normal or expected, in order to make a difference without changing something else. So we might alter the path that we take, but we're still essentially going towards the same goal. And then transforming is to change something from one state to a completely different one. For example, it results in abandoning one concept or procedure for a completely different one. Here in the state of Texas, we've had a hard time getting local anesthetic, right? We still don't have it. So it wouldn't be weird, like modifying, right? If we say we would like to do local anesthetic under general supervision. In order to maybe modify that, we might say we would like to do local anesthetic, but under indirect supervision, right? Altering is like we would like to do local anesthetic, but only for dental hygienists who have a bachelor's degree, or only for under a certain certain certificate that you have to go and get on top of whatever it is, right? And then transforming would be, we're not going to try to get local right now, we're going to try to get direct access instead. That's kind of how each of these work. Okay, so if you flip to page 96, box 7-1, this is components of planned change. And it goes through each of these, sort of the ad pie of how you can get change planned, right? And so the first is assessment, to recognize when the change is needed. And you need to collect data to verify the problem to be solved through change and identify the desired situation that results from the change. So not only do you need to see like, man, I feel like I reference this movie all the time, this iRobot, but you see a need, fill a need, right? Like, but that's for like inventing. And so here you see a need, you say, there's been an increased need in nursing homes for dental hygiene services because, patients are keeping their teeth longer. They're not as many of them have dentures, right? And so then you have to collect data. First, you have to study the populations in nursing homes, and you have to say, okay, yeah, there's been an an increase of 80% of nursing home people need dental hygiene care, and only 10% of them are actually receiving it, right? You need that study, you need that data in order to say, actually, yes, there is a problem. And then you have to kind of figure out the way to get that problem fixed, right? So, what would change dental hygiene care in nursing homes? Well, it would probably be access to care, or is an expanded scope of practice for dental hygienists to go provide dental hygiene services in nursing homes, or even to be employed at a nursing home facility where they go and do cleanings on the nursing home residents. All the time. Maybe it involves, having a dental chair in a nursing home where they can go provide services. And so you have to figure out what it is that you have to see the problem, and you have to figure out what would be different. The diagnosis would be to identify the problem that has created a need. So in this case, the diagnosis would be that patients are keeping their teeth longer, right? In this example. Um, so then the next one is planning. And you have to plan solutions or approaches and alternatives to the problem for which change is needed. In this, I'm like brainstorming. Maybe we could have a dental hygienist on staff. According to the laws in Texas right now, in order for a hygienist to be hired on staff at a nursing home or a hospital or school, they also have to staff a dentist. And then that dentist is the one who delegates all of the dental hygiene services, right? So that's not very efficient for a nursing home. Maybe they can't afford to have a fully staffed dentist. So they're not going to do that. But they could afford a fully staffed hygienist who does dental hygiene services, right? So we need to understand the advantages, the disadvantages, the consequences, whatever resources are needed, right? Like, how much does it cost to staff a hygienist? How much does it cost to staff a dentist, right? The cost. Maybe we need a mobile unit, like we saw with Miss Hostetter's presentation, or maybe we need a whole operatory, right? We need to have one of the rooms transformed into a dental sort of place. And then you have to understand the level of support that you might get, right? Are you going to get pushback from the nursing facility, or are you going to get pushback from the dental board, or where is your support going to come from? Because I'm pretty sure you could get some support from TDHA, but you might not get the same support from TDA, right? And then you decide on a course of action from the alternatives that were analyzed. So you say, this is probably the path of least resistance, and so that's the one we think is going to be the most effective for the least amount of pushback. And here you need to design a plan. Now, this plan needs to be very specific, right? It needs to have objectives. It needs to outline methods. It needs to have a timetable, right? It has to be SMART goals. It has to involve other people. You're not going to get this done by yourself, and you're not going to be able to not talk to other people when you do this. If you're going to be a change agent, you're going to have to get used to other people having a role. You have to assign responsibilities. So, who's going to do what? Assign resources. Who's going to get what? And then you have to monitor the stability. So, once you get things started, you have to understand, is this working? You're always constantly, trying to figure out, are we still doing this? Is this working? Like, what's going on, right? Implementation is where you implement the plan for change, right? Here in Texas, you're not legally allowed to do this yet unless there's a dentist on staff. And so what you might do is, get some sort of approval for a study where you do run a program like this for a certain amount of time. And then you have to collect data, and you have to, present findings at the end. This does happen. And so in order for us to sort of pilot new things, sometimes what they want you to do is to run a study where you run the program the way that you think it would work, and you get everyone on board to agree to it. You have to have a review board that watches, and then you see if it works, and if it works really well, then it could be something that is used as data to promote your change even more. Monitor for unforeseen problems. So, as things are going, problems are going to pop up. It's always going to be like that. So you're always constantly on the lookout for, who's going to oppose me and what's going to happen that's going to get in my way. Um, evaluation here, you need to determine whether the desired outcome and the stated objective have been achieved. This is hard. So this is where having measurable goals is really important, because at the end, when you're evaluating, are you going to be able to say that helped the oral health? You can't say that unless you're like, okay, yes, 50% higher, elderly individuals were able to receive dental hygiene care, and we were able to catch this many problems. And of those who received care, they're 90% satisfied. You need to have those types of that type of data in order to understand, was this a good thing and should we keep doing it, right? And then if necessary, you need to reassess the situation and modify the change. So maybe providing SCRPs for every single patient wasn't effective, right? Maybe what you need to do is provide oral health education, and you need to bring dry mouth aids into the nursing home, things like that. You need to understand that, am I being effective at the work that I'm doing? Because if you're working too hard, then you're wrong. Don't do that. So figure out what it is you need to accomplish, figure out whether or not you accomplished it, and then if you didn't, or you overexerted your resources, then you need to understand how to alter it in order to be effective. Continuing with evaluation, we have to stabilize the change by directing human and material resources to make the change permanent. So, rewards and incentives should meet the human needs of the people involved. So, basically, in this scenario, if we were piloting something like this, then we would need to say, are the nursing home patients actually getting better care? Is it helping their overall health? Is it making them happier? Are they eating better? Like, we have to look at whether or not we met it, but then there also needs to be rewards and incentives that meet the human needs, right? So if we're doing cleanings but the patients don't like the cleanings, or they're not happy, or it's not helping them in some way, then what are we doing? Why are we bothering with that, right? And then obviously always document. So you're going to, throughout the entire process, you're always documenting any services, or in the same token, if it's not a pilot study like my example, maybe it's, something of you trying to pass legislation, then you're still going to be documenting all of this. You have to have a place where other people can go and see, because if you fail, then other people need to see where you failed so that they can have their own ideas about how to carry on with your idea, right? You want other people to see your failure and to see that you tried, one, but then also to see that you had a plan and the change was a good idea, but maybe you just didn't implement it properly. And so then they can pick up the torch and implement it, in a way that you hadn't thought of, and it be successful. Okay, so documentation, even through like legislative things and through policy making, you're still going to want to have that. So then at the bottom of 96, you see box 7-2, key competencies of dental change agents. And so here we're going to talk about how to be effective change agents, right? You're going to need vision. Your vision is kind of like your idea of what the future holds, of what the life is like after the change happens, right? It needs to be sensitive to changes in the dental care delivery, professional perceptions, technology, and in a way in which each impacts the health of the public, right? So obviously, if your initiative is a public health initiative, then it needs to help the public, right? And then you need to be able to have the ability to develop clearly defined, realistic goals for a project of change. This is that person who is the solution giver, right? They're the ones who are breaking these goals down and giving us measurable, realistic goals. And then, I'm sorry, objectives. And then a generalized perspective of priorities. So if someone is looking at your vision and they're like, I don't know what you want anymore, like what's the purpose of this? Then yours isn't going to be a good vision. It's really important when you're having vision, right? A vision of the future of that, and you're motivating other people to get on board with you, that vision be shared, right? If you have an idea of what local anesthetic is going to do for the community, but then everyone else you have working with you has a different idea of what local anesthetic is going to do for the public, then you're not on the same board. Every vision, in order to be successful, in order to be a good, little organization as you move forward with this change and to be good change agents, It has to be a shared vision. Collaboration is the ability to bring together key stakeholders and establish effective partnerships. I mean, I don't know about you guys, but partnerships are hard for me. I'm not good at reaching out and asking for help and delegating work to other people. I'm someone who will take on all the responsibility all of the time because that's just how I am. So for me, collaboration is harder. And so this is where someone who is a resource linker or a facilitator really steps in and brings those particular skills to the table, and they say, hey, we can work with these people. You need to have those networking skills in order to establish and maintain appropriate contacts within and outside the organization. You know, you might be having certain contacts who are in the organization that clearly opposes you, and that's okay. It's okay to disagree with other people, as long as you're able to discuss, you know, in a professional manner, your ideas and your goals. You guys, you can have the same sorts of values and have the same goal, but have different ideas about how to achieve it, right? And then you need management skills as well to establish working groups and to define and delegate respective responsibilities clearly. So this is where, you know, things are hard for me because I'm not good at delegating, but you know, working with other people and everyone contributing, you know, their particular skill set to things is going to help it be much more effective. Communication. So, effective interpersonal communication, right? Talking to other people, predominantly listening. Listening is huge too, and recognizing the concerns of others. Okay, so when you're talking about why you think we should have local anesthetic, and every single person is telling you they don't want it because of such and such reasons, and you're still going on about why we need it, you're not going to be as effective. So what you need to do is listen to people on why they don't want it to figure out, well, how can I get them on board with me? You know, maybe they have an idea of what local anesthetic is that isn't the same as yours, right? You have a different vision. And so they might be opposed because they have a different perspective. And in order for you to get them on your side, you need to see it from their perspective. You need to have the ability to express enthusiasm in partnership ideas and stimulate motivation and commitment in others. So you have to be a team player. You have to, you know, encourage and empower and motivate the people around you and keep them going toward that shared goal. um, and you need to be able to express that. So you need to be able to tell them, hey, you're doing an amazing job, you know, thank you for your contributions. And every time they give you like add to your goal, then you need to be thankful for them, like be great, like be grateful. You need to have the ability to convey effectively the need for adaptation to colleagues and partners. So this is where you don't necessarily agree with their idea, right? And that's okay. You're allowed to disagree, but what you need to be able to do is tactfully talk to them about why you would like to change their view, why you would like to change their idea, right? Maybe they have a great idea, but it's just not cost effective, or you know, it's too time consuming, or whatever it is. So you need to be able to say, hey, I think it's a great idea. It would be very effective, but I don't think we have the funds for that. I think we need to come over with this idea, which is less expensive, right? You need to be able to talk to people and disagree with them in a way that is not confrontational, right? It's tough to disagree with people but not be confrontational. So, negotiation. So, here we really want skills to influence others to commit to plans and ideas by creating a desirable and challenging vision for the future. You can motivate people all you want. They can be on board with you, but then they leave and they don't do anything about it. It's not going to be very effective, right? So, you need to be able to say, hey, are you on board with me? And then get them to commit, right? I don't know about you guys, but in politics, whenever I meet someone who's like, hey, can I get you to, you know, do whatever? I'm like, yeah, sure, like everything's fine. And then they, you know, they're still like, well, can you do this? Well, can you do this? Like, are you gonna go home and do it right now? Like, and so I always like people who work on campaigns because they are very passionate people, but they're really good at negotiation. And then tolerance of uncertainty about the causes and effects of change. So when someone says, hey, you know, I don't necessarily want to do local anesthetic. I live in Texas. I'm a hygienist, but I don't want local anesthetic because I don't want to hurt anybody. I don't want to have that responsibility on my shoulders, which is it's understandable. My goodness. And so while yes, you need to understand that they have uncertainty about your ideas of change, you need to make it um like you need to understand where they're coming from, right? Again, listening skills. And then in this case, it's understanding that not every hygienist needs to become certified in local anesthetic just because some hygienists want to, right? Not every hygienist has to be involved in a perio office, right? Some hygienists like general, some hygienists like education, some hygienists like research. And so it's important to understand that there are other people out there who think education or research is terrible and they want nothing to do with it, right? And that's okay. You have to understand that, to each their own. You should foster cohesiveness, right? So even though you might not agree on everything, even though you might not always support all of their ideas, you're together, and you're better together. Even if you don't agree 100% of the time, you're better together. Political awareness in identifying potential hazards and balancing conflicting goals and perceptions. So you need to understand what's going on, what could be coming down the pipeline for you, and then balancing those conflicting goals, right? So understanding that we don't agree right now, but we need to come up with a solution. We need to find a compromise that will work so we can continue on this path, because if we don't, it's going to die here before it ever even gets to committee, right? Okay, so you're going to flip to page 98. This is table 7-1. It's broken down into three different groups here, but I'm sorry, more than three. And so first up is to prepare. So the first thing you're going to want to do is have facts, right? Because you're not going to be a very effective change agent if you don't know all the things there is about your change, right? You're going to want to identify issues and interests. You're going to want to use ethical principles. So again, like while you might not agree on how to get to a goal, you might both have the same drive for that goal. It might be every person wants to help other people. We just have different ideas about how to help other people, right? But everyone has that ethical principle about doing no harm and giving positive back. You're going to develop options, right? So it's not just your way or the highway, right? You need to understand that in collaboration and in working with other people, you're going to have to figure out that you have to sometimes compromise on your ideas. You're going to need to anticipate reactions. So your sometimes I don't know about you guys, but I'm not always the best at communication. Sometimes the things I say come out weird or wrong or potentially offensive. And so if I know something I'm going to say could potentially offend someone, or it could be kind of a decisive or a divisive issue, then I'm going to be cautious about the way I say it. I'm going to say it a certain way that maybe will lessen the blow a little bit, right? So we're going to anticipate how people will react to the things that we have to say. Um, and then you need to plan an alternative to that negotiated agreement. So, you have plan A, but you're going to need plan B and maybe even plan C. Select an appropriate time and place to meet, right? If you're holding a business meeting, you're not going to necessarily want to meet at Starbucks, right? Because it's too busy and their tables are weird and all of that. So you need to figure out a place to meet that is going to be effective. Now, this book was obviously written before COVID, and so they don't really take into account like video chats, I think. But like appropriate times, if you're working with someone who is being paid to do these things like legislators, then you're not going to meet on the weekends, right? But if, you're both hygienists and you're meeting to do stuff, you might meet on the weekends. We have delegate meetings on the weekends. And so that's how that works. You need to meet at an appropriate time and an appropriate place. But what's really important here is that you need to meet. The best way to get things done is to meet either in person or like in a video chat. Things get lost in translation, in text messages and emails. They're not the most effective, and you don't even know if everyone's even reading the stuff that you send them. So um, the best way to do this is to meet them where you can see their face and you can read their body language. And then you're going to want to plan your opening remarks. So when you're reaching an agreement in your collaborative style, you're going to want to figure out the most important thing that you need to get done. Excuse me. And that is where you start Okay, you need to start out with, this is the most important thing to me. This is the thing that I feel very strongly about. And this, just start with the most important thing. Sometimes you'll kind of like lead into it, right? Like people always talk about telling a joke before you get started, so you can like loosen up the crowd, right? So that might be something that you consider as well. Having like a sort of introductory thing. Maybe you give them some information first, about why you feel a certain way, and then you go into why we need to make this change, right? And then you're going to seek counsel. So you might be the smartest whole person on in the whole world on a certain topic, but there might be an aspect to your topic that you just haven't considered yet. And so you're going to need to hear other people's opinions and ideas and perspectives about it. Moving on to the firm relationships. This is how you do that. So you communicate courteously, right? Don't be rude. Personal issues, you need to acknowledge them. Um, if someone is struggling with something outside of what you're talking about, and it seems like they're not really paying attention, or they seem distracted, or they seem upset, it's not necessarily at whatever you are talking about. They could just be dealing with their own thing. We think about this a lot with patients, because patients could be upset or irritable or grumpy, and it's not necessarily at your care of them, it's that they had a bad day. So you need to respect leaders' authorities. Most of the time in collaborative style, there's someone who's appointed a leader, and you need to respect that. They have the authority in this scenario. And you need to seek to understand others' positions. So not only to seek to understand their role, that's not what that is, in like an organization, but you're also going to seek to understand how they feel on the stance. And it might not be necessarily just the person you're trying to convince, but everyone in the room. You're going to want to hear everyone's opinions on things. Um, Discuss participants' responses. In this, if someone says something that doesn't agree with you, then ask them, talk to them about why they feel that way. Seek solutions that satisfy all. This is usually accomplished through voting when you're in a big group of people. But if it's a smaller group, then you just try to compromise as best you can. Confront in a gracious manner. So if you don't agree with someone, it's definitely okay to say that, but you just really need to be tactful about it. Allow face saving. So you need to give people the option to back out of their original thought if you have convinced them of your thought, right? You're not going to want to get someone to work with you and then make them look bad. Okay, don't do that. If you want someone to agree with you, then you need to give them the information that you have that is passionate, that you feel is correct, and then you need to give them a gracious way of accepting what you've thought that is different from what they thought before. Sometimes this can be hard to do, right? It can be hard because you want them to admit that they were wrong, but very rarely in life will you get others to admit that they are wrong. Praise valid points. So even if you don't agree with someone's, overall goal, if they have good points, if they have good reasons for why they feel that way, you need to be like, you know what? That's valid. I feel that. Seek solutions that satisfy all. So this is again the same thing up here. I'm not sure why it's on here twice. Interests, you need to understand other people's interests. In order to do that, you're going to focus on interests rather than positions. So maybe they don't want to get local anesthetic, but what are their interests? Maybe their interests are the fact that they only want to go to work 9 to 5 and then come home, and they don't want to take a CE, right? Okay, that's fine. Then now we understand why you feel that way. Determine coinciding or conflicting points, right? So maybe they don't want local anesthetic, but they do want an expanded scope of practice. And you're like, well, you know what? We need to get this first. And conflicting, maybe they don't want local anesthetic, and you're just never going to agree with that. And that's okay. Seek to fully understand interests, right? I feel like this is the same as this one. And then use caution in revealing personal interests. You're not necessarily going to want to share with every single person you meet that, maybe you're a single mom, or you at one point harmed a patient, or you're never going to want to share those things in a big group setting or before you understand and know the people around you. You're going to want to be really careful about how you share information about yourself. because it could lead to other people creating a bias against you, and then you're no longer the effective person to collaborate with anymore. Um, invent. So, in order to search for creative solutions, this is continuing on to page 99. You're going to want to invent solutions based on need, right? So, you see a need and you fill a need. Expand the topic with additional interests. So, maybe it's not just about local anesthetic. Maybe it's about, the education for local anesthetic, or whatever it is. You're going to expand that topic to kind of encompass more than just your one single focused goal. Okay, so the last one is to evaluate options objectively and reasonably. This one wasn't in the slideshows that I gave you. You might notice I also kind of rearranged a lot of the slides because they were in a really weird order, and I wanted to go in order with the pages in the book. And so this one didn't exist, so I just added it. Evaluate options objectively and reasonably. So here, it's really important that you keep an open mind and be fair. Your book says fair too. Use rules of reason, laws, ethics, and culture. So we need to understand where people are coming from, and we need to follow the law. We need to be ethical, and we need to understand their culture as well. Discover reasons behind objections. So this one we've already talked about quite a bit, is just understanding what's going on behind scenes, why people feel the way they feel. Identify concession points for both sides. So, if you're able to say, hey, that part that you're arguing probably isn't the most important part of your argument, and this one isn't the most important part of our argument. So why don't we just drop both of these points, right? We don't need these things in order to achieve our goal. And then we need to identify unbendable points for both sides. So, for us, it might be the fact that we get to administer local anesthetic, but we're willing to be bendable about other things, about, the supervision or the, you know, um, education or whatever it is, but we're not willing to be bendable about actually administering local. And then we need to identify and focus on those agreeable points. So maybe the agreeable point is that we want to keep the public safe, right? That's maybe the opposite side's reason for why they don't want local hygienists to give local. And so what we need to do is understand that, okay, we can agree on the fact that we want to keep people safe. That's not something that we're even contending, right? We can agree on that, but now how do we go about keeping the public safe? And so that's the part where we might find success, is understanding where the other won't concede, so that you can get them to concede on the parts that they need to. Okay, so the next step is the things we're going to talk about. We're going to talk about policy making, collaboration and partnership, coalition building, and then all the way at the end, we're going to talk about grant writing. So the different types of government policy, or the people who make policies, obviously, are the national health policy, state health policy, and local health policy. But before we do that, we need to understand policy. So policy is a written description of rules, regulations, and stipulations to govern individual actions and procedures. We talked about this a lot in the laws of the last chapter, but here policies are kind of also how laws are enforced, like the rules and regulations, but it's made through health agencies. Um, and it's also one of the important things in your book. It talks about ethics here. So when we're making policies, it's important that we use those ethics as a guide. And the ethics are the guiding principles for individuals or groups based on what is right and what is wrong. So, a national health policy is where the federal government adopts national policies on behalf of and in the best interest of the public as a whole. And so, there is research that is done, and they record the status of health in a particular nation. This is not like, if you think of like the census every year, that's how they find a lot of information as far as public funding and things like that. They need to know who all lives and where all of them live, right? And then they determine guidelines and set goals to affect change in the nation's health. And so, this is where the Surgeon General steps in with the public health systems, and they talk about, Healthy People 2020. They do the call to action to promote oral health, things like that. That's where that Surgeon General really comes in. And then the manager of policies and funds, that's kind of the Surgeon General. They're the ones who go over, okay, well, there's a lot of need here, but not as much here, so we're going to give them more money. State health policy is responsible for carrying out federal policy, right? They are the ones who get the money from the government and then they allocate it, right? They give it where it's supposed to go. And it determines protocol for implementation. So, even though the federal government might say, hey, we need more help in oral health, they give the money to the state, and then the state says, we're going to give you a grant, we're going to give you a grant, everybody gets a grant, right? There's Oprah in here. And then each state has a designated dental director or representative that manages oral health programs, right? So we talked to Ms. Hostetter. She works more on the local level, but essentially she's a director. And so she is the one who dictates where the money goes and who gets it and who gets hired and who doesn't and who works what days and who doesn't, right? Um, when needed, policies at a state level are changed to implement programs effectively. So, when something isn't working or if it's not achieving its goals, well, then it doesn't keep going. I mean, it's not unfortunate because if it's not effective, then it's not effective. It doesn't need to keep doing anything. Local health policy. This is here, like in San Antonio. A local health policy is developed by local health departments, right, where Miss Jody works, or Miss Hossetter, sorry, and or city or county governments. So these partnerships create a breeding ground for change agents. This is where the people are, right, the local level. And so here is where the people start to make those changes. They're the ones who run the studies. They're the ones who get funding for these types of programs. These are the people on the ground doing the work. Local policy establishment and enactment are supported by professional associations, by local businesses, by private foundations, and by educational institutions. So, the studies that I'm always talking about, pilot studies, things like that, these are where all of those things are happening. So, educational institutions are obviously running studies. Private foundations, sometimes they'll run a study in order to see if there's need so that they can make money off of those people, unfortunately, right? Local businesses get into it because it's a good way to get marketing in a charitable way that they wouldn't necessarily get marketing in. So that's why a lot of local businesses will sponsor or support certain health initiatives. And then professional associations, obviously, like the San Antonio Dental Hygiene Association, but also like the Hispanics Dental Association, things like that. They're all getting in on these kinds of public health policy establishments so that they can, do their job and help the public. That's what we're all here for. Lobbying for change. So this is in your book on page 100, and it's the attempt to influence or sway others towards a desired position or action. So anytime you're trying to sell something or get someone to do something for you, right? You're lobbying, right? Not necessarily, right? So the art of the sell is what your book talks about. These are people who are good at kind of schmoozing their way to get people to agree with them, right? So most valued assets of lobbyists are their established relationships. We talked a little bit about this in the last chapter as well. Lobbyists they're very important. They know people who get them in the door, and they are able to talk to people that maybe the organization who's trying to get the change to happen wouldn't be able to get in and talk to. A tool to provide advice on strategies, tactics, and procedures to maximizing your effectiveness. So a lobbyist is someone who can look at your policy and say, you're probably not going to get it passed like that. That's probably not going to work. Congress people don't care about that kind of thing. This is what they care about. This is what they're going to hear. And this is how you go about doing whatever it is. So, if you go talk to anyone in the TDHA to talk to them about how do I help? What do I do? They might give you, that white paper and they tell you here, go talk to these people about this thing. You need to find your representative, go find your legislator. And most of the time that's kind of the way to get things done, is to talk to people who want your vote. Provides access to those whom the change agents wants to influence. So this is they get you in the door, right? Maybe you want to talk to your legislator, but the secretary never calls you back, right? So this is where you get a lobbyist who, goes and talks to that secretary because they know them, and then all of a sudden you have an appointment. Yay, you. Um, The next part is on page 101. This is working through collaborations and partnerships. So there is strength in numbers. Working together is always going to be better. We're going to talk about partnerships and collaborations. We're not really going to talk about teams, but it's on here because they're the same thing. So, collaboration is the process of working with others towards a common goal. There can be two or more organizations or individuals who work on a task of mutual interest and benefit. So, everybody's working towards that same goal. In public health, it's everybody's working toward public health, right? Strengthened through networking. So, anytime you know someone who that person also knows, they feel a sense of trust towards you. This happens a lot in dental. Everybody in dental knows everybody else pretty much. I remember when I was first getting hired at my office. I had worked in a different office with, I had just temped there a couple of days. And the dentist that I was hiring with asked me about a couple of places I had temped with or any dentists I knew. And of course, I tell him all the people or all the dentists I knew, and he knew a few of them. And so I was able to kind of get my foot in the door because of people I knew. And then cooperation is really, really important. If you're not willing to cooperate with the way other people want to do things, and you want to put your ideas out there, but your idea isn't the only way to do things. So you really need to stay humble when you're working in a collaboration because you're not always going to be right. Partnership is where we take that collaboration of working together to kind of the next level. It's the state or condition of associating or participating with others regularly regarding a joint interest. It's an intense form of collaboration. I like the way that says that. An agreement between entities. So this can become important when you have new healthcare needs, trends, or issues. It's demonstrated through the fortification of relationships involved in the process of change. And in this is where we talk about the next level, right? So you have a collaboration, everybody's working towards the same goal, and then suddenly you decide to write some things down, right? These are not contractual agreements, right? Like you will draft legal documents or contracts. Typically, they're not something that holds up in court. It's not enforceable. Like you're not going to get in trouble if you don't go through with whatever it is, but it's a way for you to go to somewhere else and say, hey, I'm contracted with this other association, we're together, and you have a little bit more sway when you have that. um, a partnership doesn't necessarily have to be a legal document, but a lot of times it is. So, a formal partnership document would be a memorandum of understanding or an MOU. I think of IOUs every time I've read this. So, a memorandum of understanding is a legal agreement that some formal partnership is happening, right? It's being used, but because it's not a legal document, it's not enforceable in court. Okay. In most cases, the people who signed the MOU indicate they do not intend to try to enforce its terms, all because you're not trying to force someone else to do what you want them to do. You just want everybody to agree to it, right? You want a piece of paper that says everybody agreed to this. um, it also talks about affiliation agreements and partnership agreements, because sometimes educational institutions will use an affiliation agreement, which is the legally binding contract made between one entity, such as like a clinic or a hotel or a hospital, and an educational institution that allows students to participate in an internship or other educational experience, right? So we don't do that here at Concord, but other schools do send their dental hygiene students out into the world to practice, and they have to have an affiliation agreement with the other company that says we're going to send dental hygienists to you. We trust you to take care of them and only allow them to do things that they're supposed to do, but also you trust us to only send you students who are passing and who are actually students, right? Um, a partnership agreement is not a binding, it's not a legally binding thing. So this happens a lot through like nonprofit organizations, who they work together, they promote, collaboration. It's just a really nice way of working together, and everybody agrees to continue to do so. Coalition building, so cornerships of of creating successful change within a community, partnerships that function on a larger scale. They come in a variety of forms like permanent, temporary, single, or multi-issue. and they increase the potential for success in creating policy change. They increase public knowledge, they create a network, and they develop an innovative solution to complex problems. And so, whenever you can build a coalition and have that sort of group of people, you're going to be more successful. So, a coalition is an alliance of distinct organizations or persons to take a joint action, right? As everybody's ready, we're not just agreeing on things anymore. We're not just like, hey, I'll help you out, scratch my back, scratch your back anymore, right? Everybody's ready. We are working together and we're going to do something. Okay. Um, a lot of times when there is a coalition, you'll have stakeholders, and these are individuals who are in the organization who have a particular invested interest in a specific topic, issue, or initiative, and they usually compose coalitions. My dog is snoring on the ground right next to me. You can probably hear her. And then she stopped. um, okay, moving on. So a goal. What's a goal of communicate of a collaboration would be influencing or developing public policy, right? Well, our goal is always the same, right? We want to have public policy change, and so the we might build a coalition, but we're not just building a coalition for no reason, right? We have to do something with it. Or it might be changing people's behavior. So you might have a coalition towards oral health where you try to get people to take their kids to the dentist, and so that would be a lot of people who would work together in order to educate parents in order to get them to take their kids to the dentist, right? Or you could be building a health community. So sometimes a coalition will work together to build a building and run a company and have some sort of um, project going. The barriers to coalition. So this is on page 103. It's in box 7-3. We're going to talk about each one of these. So um, first is a turf issue. This is something I touched a little bit on in the beginning, but a turf issue is when the organizations can be sensitive about sharing their work, their target populations, or especially their funding. Part of creating the coalition may be to convince a number of organizations that working together will, in fact, that'll benefit both of them or all of them and better address their common issues. But sometimes it can be hard to get people to share. I'm not really that good at sharing either. Negative history. So sometimes you have worked with someone in the past and it didn't work out, or something happened, or a lot of times it's individuals within a coalition that don't necessarily agree with others, and they have a bad history with them, and so you might have to contend with that. When you're a new coalition, you have to contend with that history before you can actually start to see progress and move forward and move on from whatever that issue was. Um, I think this is one of the biggest issues here, why the TDHA and the TDA don't work together for a lot of things, because they have been disagreeing about quite a few things for quite a while now. And lobbyists, TDA pays lobbyists to lobby against us. So that's a little negative. Um, Domination by professionals, right? This one I feel like is not tangible as much. It's not as easy to understand as some of the others, but sometimes the people who are working in the coalition are the people who are very good at their job. They've been doing it for years, and they don't necessarily want anybody else's help. They don't necessarily, want anybody else's opinions. They know everything they're supposed to know, and so sometimes when you are kind of in their rush to solve problems or to help the disadvantaged, the agency people with advanced degrees, local politicians, business leaders, and others kind of neglect to involve the people who are most affected by the or who are the most affected and who are otherwise affected community members. So creating a participatory atmosphere and reining in those who believe they have all the answers are almost always required when starting a coalition. Poor links to the community. This is kind of a little bit of the last one too. We're not including the people who it's most important for. So the first step may have to be to develop the hitherto non-existent relationship among agencies and the community at large. Um, and then a minimal organizational capacity. So it might be necessary to find a coordinator or one or more individuals or organizations to seek a way to share the burden of that new group if it's developed beyond that first meeting. So understanding that you have your own individual organizations and each of them have their roles, and everybody kind of has a job description, and then when you start working together as a coalition, you're going to need people who organize the coalition together as a whole. So either you need to bring on new people or you need to give people who already have jobs more work to do, and people aren't always happy about that. Funding is huge, right? The difficulty of finding funding is obvious, right? It's a little less obvious that the dangers of available funding that pushes the coalition in the wrong direction or requires it to act too quickly to address the issue effectively. So sometimes new coalitions should be alert to funding possibilities from all quarters and to be vigilant about the kind of funding they apply for and accept. So if you accept certain funding, it might make you ineligible for other types of funding. So you want to be careful about where you apply. And then also, you want to be careful about, you might see the opportunity to push the issue before you have all of the data. And that would be a bad idea, right? Because if you don't have all of the data and then you go to argue your point and then somebody else has a much better thing, or they bring up the fact that you don't have all the data, then that would be a waste of time and it's a huge waste of money. So the next one is failure to provide and create leadership within the coalition. So again, you have your two organizations, everybody has their roles, everybody has their own unique ways of doing things, and they have their own hierarchies. And when you put them together, you don't necessarily have a hierarchy between the two, right? You have a lot of leaders and not a lot of followers sometimes. So it's necessary to bring in maybe someone from the outside or to even train someone new who can sort of develop that hierarchy and see, okay, who's going to listen to whom. Um, Failure to show benefits or perceived or actual costs of working together. So sometimes, I don't know if any of you guys have ever noticed it, you start working in a group, or you're working for a company, and then they're like, hey, we need you to do this thing. And you're like, that's going to cost me money, like my money. Right. And then you're like, I don't necessarily want to do that, but you already agreed to it because you didn't know it was going to cost you money. Right. So that's kind of what they're talking about here. Sometimes organizations get together and they think, okay, we're gonna, do whatever this goal is. And then all of a sudden there is a need for money that isn't being covered by the funding that you have. And so then one or all, or maybe all of the organizations that you have are responsible for money that they weren't necessarily agreeing to. Um, or you don't show them how they benefit from it, of that cost of working together, and so you might not create a coalition at all because they don't understand what they get back, right? Some of you have a hard time joining professional organization. You think, why should I, what's the point, right? And it's hard to understand what you get back from it because you understand how much it costs. But I I think what's important here is the fact that we're not showing you the benefits. You're not seeing just how much you can actually get from it. And there are too many hygienists out there who don't understand um, what they could get back. Okay, so grant writing. Um, Grant writing is a really important aspect of working in public health because a lot of the money that you get for your programs, it doesn't necessarily come from the federal, state, or local, um, of wherever it is, that you're being funded through. Just like we talked with Ms. Hostetter, they provide some money. If you're going through the city of San Antonio, then sure, the city of San Antonio is going to give you some money, but it's not going to be enough to actually fund your program, right? So you're going to need to find grants, and that's how they pay their bills. Um, when you do a grant, first you have to find one, right? You have to find one that you're eligible for. I'm going to show you what that looks like on the next slide. But you go to grant.gov. I know it's crazy, and then you search for a grant that has something to do with what you're looking for, and you have to request or apply for that funding. So there's all these dates for like the date that it was posted, and if it's still going, if it's ongoing, if you're eligible to apply, then you can just send in your application. It's not the only place to find grants. There are a lot of private grants that you can find. They're just a little harder to find. There's not a nice little filtered search bar for you to find them. So that's how that works. You apply for the money, and then if you're chosen, you get it. And typically you get it once. It might be over a specific period of time. It just depends on the type of grant you get. And once that happens and the money is done, I mean, you can apply again, but the odds of you getting it again are much lower. And so after the grant runs out, then you might be out of money. This is what that looks like. So you go to grants.gov and it kind of looks like this. I typed in like dental public health, I think. And so this is what popped up. And so when you come down here, you can see the type of public health thing that it's about, the funding opportunity title, and then who it does, who's funding the money. And so it does look like U.S. aid, foreign assistance for programs overseas. And so the purpose of this amendment is to cancel. Oh, well, they're amending it. But anyway, this is the date that it was posted. This is the date that it was last updated. If you look up here, you see the apply is kind of grayed out. You can't apply for this grant anymore. It's done. But you can see down here who's eligible. So, based on you read the eligibility and you find out, is my program eligible for this money? And then there is a very long process for writing the grant proposal that you would send to these guys. And we're going to get into that. That starts on the bottom of page 104 in table 7-2. So first up, you're going to need a cover letter. I know, like a title page, a cover letter kind of just sets the stage, right? So you're going to include the project title, whatever your project is about, the name of the agency. So if you're working in a company or a coalition, you're going to want to put all of that information there. You might be an individual, although the likelihood of that is low. Submitting the grant proposal, the agency address, of course, so they can send you a check, right? Name of the prospective funder, so if you're getting funding through like the city of San Antonio, but you need extra funds, then you say, anyone who is potentially going to give you money, you're going to put them on here. Beginning and ending project dates, and then total amount of funds requested. So even though the grant might be up to $100,000, if you don't need $100,000, you're not going to ask for all that money. You're going to ask for what you need, which is why when you guys were in public health, you documented exactly, excuse me, what each of those things would cost. That's why. That's what this is. That's what you did your public health project on. That's kind of a grant proposal. It's not exactly as polished, but it's pretty darn similar. So you get your title page and your abstract, like if you're doing a research proposal, and they briefly describe the major points of the proposal itself. You're going to need a needs statement. This is a pretty important part of grant writing. Basically, it's kind of like the literature review, right? You're going to assess the needs. You're going to say, here is the population that we are looking to help. Here's the demographic information. Here is all of the information for, why they need whatever this is, right? There's a very specific way to go about this. If you ever get into public health or health studies, then you'll see exactly how to write a needs statement. Those documents present the problems that are addressed with text, statistics, graphs, and/or charts. It's always nice when you put charts in your stuff. It should also describe the causes of the problem, creating the need and identity solutions. It's this really cool like four play chart, and so you start out on one side with like all the good stuff that whatever your proposal is going to do, that's going to be amazing. And then here you have like an intervention, whatever your program does. Maybe they are educating pregnant women on infant oral health, right? Here's like happy babies right here. So then this third chart here is like all the reasons that, moms might not be able to properly take care of their baby's health, right? Might be like socioeconomic status or like low income, right? We might be talking about education levels. We might be talking about perceived health benefits, right? Maybe they don't think that having a healthy mouth early on is really that important. So value, chart, things like that. That's the information that goes in this thing. And then right here is like the problem. So the problem is that babies, mothers aren't sure how to take care of babies' teeth, and so babies get the early childhood caries, right? So here, early childhood caries, all of the factors that go into the early childhood caries, whatever your intervention is going to be. Maybe it's education, maybe it's sodium fluoride, not sodium fluoride, silver diamine fluoride. My goodness. And then this over here is happy babies, right? That's kind of how a needs a statement pretty much works. It's like this chart thing. And then project description is three main parts. So you have your goals and objectives, never getting away from those, the methods that you're going to use in order to address that problem or need, and a timeline for completing each component. So you're going to say, here is our goal. We're going to reduce early childhood caries through arresting cavities with silver diamine fluoride. And then your objective is going to be to place silver diamine fluoride on, 50% of the children who come through a hospital, right? A children's hospital. And then your objectives might also be that you actually arrest caries on 25 or 50% of the children you actually place silver diamine fluoride on, right? And then you're going to need a timeline. So you're going to say, we're going to see maybe at least 100 of those children in a certain amount of time, and that's how they do it. That's how it all works. So you have a timeline, you have some sort of goal in mind. As far your goal is always like big and broad, right? It's always vague. The vaguer the goal, the better, right? So your goal is probably to reduce caries lesions or reduce cavities in children 0 to 6 years old, right? Early childhood caries. But then your objective is where things start to get really detailed and serious, right? So that's where you're bringing in those SMART objectives. An evaluation plan shows the organization shows how the organization will measure these successes of the program and outcome objectives, right? So if you're doing that plan with the early childhood caries and you're going to a hospital and you're placing silver diamine fluoride on children who maybe their parents highlight that they're in a poverty or they're below the poverty line, and so you're able to easily see which children need silver diamine fluoride. And if you're in a hospital setting, maybe you have a dentist on staff, and so you're working to place this SDF on on the children's teeth, right? And so what you'll do is you'll measure. Okay, we have 100,000 patients. Well, that seems like a lot, actually. So maybe like 2,000 patients who come into the hospital that are potentially patients that you could put SDF on. They're patients who have a need, who fall below the poverty line. They have a carious lesion, right? Because you can't put SDF on something that's not a carious lesion. And then, so you're going to say, we're going to place SDF on at least 1,000 of the students, right? And part of that is that you're not going to get approval from all of the parents. Maybe parents don't want their children's teeth to be black. They'd rather have a silver cap. And so we're looking at we need to be realistic with our goals, right? We don't want to say, I want to put SDF on every patient's tooth, because that's not realistic. And so we're not going to get them all. You win some, you lose some, and you got to accept that. So realistically, we're going to put it on probably 50% of the children who are eligible. And then realistically, we're going to probably get 50% of them who come back again, right? Or we have access to reach them out and find out, to be able to evaluate our success. And so, maybe only 50% of them actually come back, and we're able to measure 50% of them. And then of those, we're looking to see that the SDF was effective in at least 75%. And all of that information is written out in an evaluation plan. It goes over those details for how that information is collected, how we analyze that information, and how we share it with the people who are giving us money. Because when someone's giving you money, they want to know what is happening with their money. The budget request and budget justification. So this is where we go into who is on our salary. We go into the direct or indirect cost of the supplies, right? Sometimes the cost is direct, like we're buying it specifically for, and then sometimes it's like maybe we're getting some of those things from the hospital, but the hospital isn't doing whatever, so we have to like pay the hospital, and the hospital gives us supplies. All of those things like overhead. And then equipment, sometimes, especially in public health, a lot of things get donated. My cat is actually trying to get in right now because it's time for him to eat. And so he's mad that I closed the door on him. But so the equipment, a lot of times with public health, because everyone wants to help in public health, but it's just like it's hard. You can't like give up your whole life. You can't, dedicate your whole life to public health sometimes because it's not realistic for every hygienist. But we all still want to help. We all want to give back. We want to help the community. So we might do things like having volunteers or having supplies donated. Anytime you can get money given to you, like money, that'd be great. But anytime you get stuff and supplies too, you never want to look a gift horse in the mouth because you never know how much money it's going to cost you, down the road. It might seem like getting 100 toothbrushes and 100 toothpastes from Crest seems like that company could have given us a whole lot more because they're such a big company. It still saved you probably $50. So you just be happy that you got it. Okay. Any kind of donations, money or supplies, that's where all of that is. You have to have a budget justification. So if you're saying that you're paying your dentist who only works 2 days a week, $100,000 a year, well, you're probably overpaying your dentist and you're not going to be able to justify that. So you have to be really realistic and you have to be very, very specific when you go through your budget. Applicant qualifications. So someone who signs up for a grant proposal, they're applying for a grant. You can't just be anybody, right? You have to be someone who um, is qualified for whatever the program it is that you're asking to do, right? So if you're a hygienist and you're asking for money for, a program that really should be run by a dentist, then you're probably not going to get the money. But if, you're a hygienist and if you're me and I have a master's degree in health science, so my asking for public health funds, especially because my specific degree falls under the community health sort of blanket. And so yeah, I would be someone who could write grant proposals, right? But it wouldn't be someone who, an English major is not going to write a grant proposal for a dental hygiene public health. Right. So future funding or sustainability plan. So it might be that you're asking for this grant money so you can buy the startup costs, but then you have someone who is willing to pay you those like annual fees, right? Things that come back around. And so you're going to talk to your grant proposal about that. You're going to say, hey, I think $100,000 is a reasonable ask because I'm not going to ask for $100,000 every year. I need, $20,000 every year to keep this going. But I only need $100,000 so I can buy all of the equipment initially. Because equipment's usually much more expensive than supplies. And then appendices are where you are any kind of material that don't belong in the body of the proposal, but that are important data. So sometimes, in your grant proposal or in your methods, right? The methods section of how you're going to run the program, you might have like a questionnaire or like a satisfaction survey or something like that you want to incorporate into your plan, but you're not going to put the whole satisfaction survey in your paper or in your proposal. You're just going to put that the whoever patients or the patient's parents might be getting a satisfaction survey, and based on those responses is how you're going to evaluate the effectiveness of your program. But in your appendices, you're going to put the whole entire the whole entire thing. Yeah. So anyway, moving on. Okay, so that's the end of grant writing. if any of you ever find yourself in a situation where you need help with a research for a proposal, um, I hope you reach out. I hope you ask, and I'll certainly help you any way I can. Um, so that's the end of this chapter. And change, yeah, it is difficult, but it can be accomplished by individuals, collaborations, partnerships, and or coalitions. And advocacy. Advocacy is a wonderful thing. You advocate for change. So, while it seems like becoming a part of the legislative sort of push for some of the stuff in Texas, it doesn't seem like it would directly affect you. It does, and the more that you advocate for the expansion of dental hygiene, in Texas or in any state, because states look at each other, um, then you're essentially advocating for every individual out there who needs help, who lacks access to care, and they have barriers. And the more that a dental hygienist can do as a mid-level provider, or even just as our level provider, then the more of that need that we can meet. So don't be afraid to get involved, and advocate not only for the community as a whole, but it really helps the individual as well.